This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. I'm Kyle Wiggs, and good morning to you. Good morning to Katherine Jones. She's a physical therapist, Stonewall Jackson Memorial Hospital. And Katherine, good morning. Thanks for your time.
Good morning. Thanks for having me.
Tell us about what you do. What are your day-to-day duties?
Well, my day-to-day duties are mostly in an outpatient orthopedic clinic, and I began doing pelvic floor therapy about a year and a half ago. I have worked at Stonewall Jackson since 2001 and primarily focused just on orthopedics, and I would say that my subspecialty was more hand therapy. But part of our licensing requirements each year are to attend continuing medical education seminars, something relevant and interesting to us. But when COVID happened, we really didn't get the opportunity to do that much. All of our learning was very solitary and online. So when that ended and we got to attend workshops and seminars in person again, I was super motivated and very excited to learn something new. And that's when I took a very basic introductory course in pelvic floor physical therapy, and it really clicked with me. I was very interested, and I thought, I really need to pursue this further, and my community needs this. So I've spent the last year and a half doing much more extensive training on pelvic floor, and it turns out I was correct. Our community does need this, and my caseload is almost exclusively pelvic floor patients now. So that's what I'm doing. Okay,
so pelvic floor therapy, and we're going to get into that in a moment, but take a moment and talk about Stonewall Jackson Memorial. You say you've been there since 2001, but it's a recent acquisition, right, for the Mon Health system and Vandalia Health?
Right. I've been here since 2001, so I was already part of the hospital when the merger into the larger health system happened, Mon Health and Vandalia, and they have been amazingly supportive of this professional growth for me. Marketing has been wonderful. They make sure that I have all the training that I need and all the resources and materials in the clinic to treat my patients.
Okay, so Stonewall Jackson Memorial Hospital, and first of all, what's the number to reach you there? If we've got listeners in that region and they hear something that they're interested in, how can they get a hold of you?
The direct number to our clinic is 304-269-8097.
Very good. Okay, so we're here to talk about pelvic floor therapy. Define that. What are the groups of muscles that make up the pelvic floor?
Well, the pelvic floor is just kind of a blanket term for the muscles, ligaments, nerves, and tissues that create kind of a natural hammock sling across the bottom of the pelvis. And the function of the pelvic floor is, for example, to hold back bladder and bowel function so that we can decide when to void. The pelvic floor also supports the pelvic organs. It controls sexual function. It stabilizes the low back and the hips and the pelvic girdle. And the pelvic floor also works in direct conjunction with the diaphragm, which is just kind of a general term for the breathing muscle under the ribs. Pelvic floor function and mobility has got to be in sync with the diaphragm for proper functionality. And I really consider that concept the mothership of treatment. We address breathing first and foremost. The pelvic floor also holds tension, just like the muscles in your neck, your upper and lower back or jaw, and so forth. When you are under stress or feeling tension and you feel your muscles knot up, the pelvic floor is also likely harboring that same tension as well. For example, when the jaw is clenched, the pelvic floor is also tensed. And when the pelvic floor is in a state of tension, it cannot move or function properly. So your general level of tension and anxiety greatly affects its function.
So it's not an exaggeration to say that the pelvic floor is connected to most body functions, correct?
Absolutely. Most body functions, yes.
Okay. So when people have pelvic floor issues, this is a result. There's many things, but I guess the most common are childbirth, right, in women, and also. Go ahead, elaborate on that.
Yeah, well, not just that's certainly something that can affect the pelvic floor, but the pelvic floor is not. People tend to think that we treat mostly incontinence, and certainly we do see a lot of patients that have incontinence, but pelvic floor dysfunction is the underlying cause of a huge number of common but not normal problems with pelvic health. And some of the more common conditions that might have a pelvic floor dysfunction as an underlying cause or a contributing factor would be just pain. And the pain can be in the low back, the tailbone, the abdominal region, the ribs, hips, groin, the perineal or genital region with sexual activity. Also, incontinence, and there are different kinds of incontinence that we treat. Two of the major types of incontinence are stress incontinence, which would happen with stress or a forceful exhale, such as a cough or sneeze, yelling or jumping or running, things like that. And then also urge incontinence, which is more described as a sudden urge to urinate and then an inability to hold it once the urge hits. We treat pelvic organ prolapse, and that is something that can happen from childbirth. It can also just be a hormonal change, menopausal change, or different, or something like that. Constipation, people are surprised to know that, yes, we treat dysfunctions of the bowels too, and in fact, constipation can be an underlying cause of urinary incontinence. We treat different types of sexual dysfunction, recurrent UTIs, urinary tract infections, or just signs and symptoms of urinary tract infections. We treat bedwetting, and then, like you mentioned, the issues during pregnancy or postpartum phases, such as a diastasis recti, which is kind of a split in the abdominal muscle, tissue trauma, pain, incontinence, difficulty returning to intimacy with a partner, or other myofascial or musculoskeletal strain related to pregnancy and childbirth. So a huge amount of factors that can affect the pelvic floor.
Again, that's a lot. And again, most functions of the body, that goes back to it being connected to the pelvic floor, which some people may not consider.
Absolutely.
Okay, so you went through a long line of symptoms there and issues. Yeah. If someone is experiencing any of those things, they come to you or they come to a trained professional like you, what can they expect when they come and sit down with you for a consultation?
Well, they can expect a lot of questions and a lot of personal questions that they probably haven't been asked before. We take a very detailed intake. There are lots of questions about what's going on with the symptoms, with history. We take a look at sleep patterns, jaw clenching. Are you a mouth breather? Do you have sleep apnea? Do you snore? Nutrition, health and lifestyle, exercise, hydration. We take a look at a regular physical therapy evaluation that people may expect for posture, for movement patterns, general mobility, strength, neurological status. Again, we will assess your breathing patterns, and that is key. The breathing patterns regulate your pressure, and like we said, the pelvic floor dysfunction is often a product of mismanaged pressure in the abdomen, and different things that can affect breathing pattern would be tightness of the back and ribs, which people are familiar with seeing a physical therapist for, trigger points or tissue and fascial restrictions. and just general level of stress. Also, we will do an internal exam, and that surprises some people. People didn't know that physical therapists did that, and some ask, why are you doing that? And we need to assess the internal tissue integrity. Is it painful? Is it tense or hypertonic? Are there trigger points? Is there scarring? Is the sensation intact? Are the muscles symmetrical? We can feel for an organ prolapse, and we can assess the person's ability to perform a contraction, which people are familiar with a Kegel exercise, but up to 40% actually of women have a very ineffective effort for doing that exercise with just standard instruction or Googling their symptoms, or, well, somebody said I need to do Kegel exercises, but basic verbal and written instructions aren't adequate for that. And patients, we have found, don't really have good awareness of the pelvic floor muscles and how to contract them or relax them or lengthen or bear down. And sometimes the patient is doing the exact opposite. So trying to fix things like this on your own can potentially make your problem worse. So it's a very detailed evaluation, and typically the causes of pelvic floor dysfunction are numerous, and there is a lot to unpack and a lot to work on.
Yeah, this sounds very complicated. But again, a lot of symptoms there, a lot of common symptoms that people have that, again, could be traced ultimately to the pelvic floor. So it's worth getting an evaluation. We are with Katherine Jones, physical therapist with Stonewall Jackson Memorial Hospital. We're talking about the pelvic floor and therapy for some of the symptoms we've gone through. And again, you can reach Katherine at 269-8097. That's the direct number for Stonewall Jackson Memorial Hospital. We get a break in here. We'll come back and we'll talk about some of the treatments for the symptoms we've discussed. This is Mon Health Talk for this Monday morning. Stay with us. We'll be back right after this on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Our guest is Katherine Jones, physical therapist, Stonewall Jackson Memorial Hospital. We went through a long list of symptoms that perhaps could be tied to your pelvic floor, the muscles and the things that are going on down there, pain in the lower back, tailbone, rib, hip growing, etc., incontinence, constipation, bedwetting, on and on and on. So, Katherine, now let's talk about learning what's going on, right? You come to you for a consultation. You have to figure out what the issue is, and the patient has to be educated as to what to do, right?
Correct, yes. And it can be overwhelming. There's a lot of evaluation process to unpack, and a lot of education goes into treating a pelvic floor dysfunction. So it, like I said, it can be a little bit overwhelming at first for patients. And the most important thing that I try to tell everybody is that it's a learning process, and that they need to be patient with progress. Some of the treatments that we do, we typically start with breathing. I've mentioned before how important that is, and so we figure out what is preventing an optimal breathing pattern, and we fix that. And we do bowel and bladder training, which is also very extensive. We deal with nutrition and hydration, different positioning techniques for voiding, behavioral modification techniques, identifying anything that the patient might be taking in that is causing a problem, whether it's a fluid that's a bladder irritant or a food. We can help the patient identify dysfunctional voiding habits and correct those, and we'll talk about those here in a minute. But we help correct posture, teach good functional movement patterns, and then there's a lot of manual therapy involved to help normalize tone, to get rid of trigger points, providing proper biofeedback for the patient so that they'll know that they're properly performing the movements that we want them to do. Are they doing a pelvic floor muscle squeeze? Are they doing a relax? Are they doing an elongation or a bulge or bearing down? There's neuromuscular reeducation involved to teach the muscles how to behave, either to how to relax or let go or how to contract. Pretty much we just figure out what's weak, strengthen that, what is tight, stretch and relax that, and help to coordinate muscle firing so that the right things are happening. And because we want to get people back to doing what they want to do.
Right. Again, that's an awful lot there. So let's get into I guess one of the things that you hear a lot is that, in terms of there's different levels of incontinence, but
yes.
people, laughing, coughing, sneezing causes that. That's to them it might be minor, but it's something they can get help with.
Yes, yes, it's not normal. People, that's one of the biggest things that I hear. Well, I thought it was normal that I leak urine when I laugh or I try to run because I've had 4 children or I've had this surgery or I'm this many years old, or I thought it was just something that happened with older age, and it's never normal. It's never okay, and it can be treated.
Okay, so simple as that. These situations, as you said, when a patient comes to you for an evaluation, there's a lot of questions, and a lot of them are personal questions. You mentioned some that people may have never been asked before. So there's an embarrassment factor to that, perhaps.
Yeah.
Is that why maybe people seek treatment for some of these things, or they don't seek treatment?
There is a little bit of embarrassment sometimes with the questions that they're asked. They don't want to talk about that they have to use pads, or they might not go out because they feel like they smell bad, or they don't want to wear disposable briefs. They don't want to answer questions about sexual dysfunction. But the fact is, a lot of people aren't being asked these questions by a provider. Sometimes those bowel and bladder function questions at the doctors are skimmed over. The patient might be asked, everything okay with, bowel and bladder? And the patient might say yes, and then that's the end of it. So they're not being asked, oh, okay, so you're not leaking urine. You're able to make it to the bathroom. You're not having to wear a disposable brief or a pad. You're not having pain with intercourse. You're not having bleeding in the urine. You're having a bowel movement every day. So those specific questions aren't being asked, so people don't realize that it's a problem.
Okay. Again, we've covered a lot of ground here, and a lot of people are going through these situations that you can get help with them. How can people, what's the first step in terms of people interested in coming to see you about this, or another physical therapist that has a specialty in pelvic floor with the Mon Health system? What's the first step?
The first step would be to contact your provider, your doctor. It can be your primary care physician. It can be a urologist. It can be your OBGYN. But we need a doctor's referral to get started. And then once the patient has that, they can call and get a scheduled appointment. Okay,
we're down to about the final minute. So again, what would your encouragement be to people who maybe are they're suffering through some of these things, but they're reluctant to seek help? What can you give these people in terms of hope that they can get help?
Please give it a chance. This patient population is grossly underserved, and not a lot of people know about all of the different conditions that we can treat. Just remember that pelvic floor dysfunction can be the underlying cause of so many common but not normal problems. Women feel that the issues that they're having, or women or men or children, are just conditions that they have to live with, but it isn't true. I just feel that pelvic floor therapy is groundbreaking, and that patients are discussing conditions with us that they're not talking about with anyone else. And we want these people to feel heard, and we want them to have hope that their issues can be resolved. So again, it's a quality of life issue. Absolutely. Very good. Well, great information. Again, a lot of information, and we understand you've studied hard on this and learned all about it, right, since the pandemic, yep. Correct? It's an ongoing process. Ongoing process. Very good. Katherine Jones, physical therapist with Stonewall Jackson
Memorial Hospital. And again, you can reach the facility at Stonewall Jackson Memorial, 269-8097. That is the number to call. Katherine, again, great information, and we encourage people to reach out and get help with some of these issues.
Thank you very much.
We appreciate your time. Katherine Jones, physical therapist, Stonewall Jackson Memorial Hospital. That's Mon Health Talk for this Monday. Thanks for listening, and stay tuned. News is next on WAJR.